Hi, friends. Good morning, good afternoon, good evening. Today, I'm going to talk something about coronavirus or COVID-19 pneumonia. COVID-19 pneumonia, is it a silent killer? Pneumonia caused by the coronavirus, that is a COVID-19 virus, having a stunning impact on the healthcare system all over the world. Is it a silent killer? To some extent, answer is yes. Pneumonia is an infection of the lungs in which the air sacs filled with fluid or pus. Normally, patients develop chest discomfort and other breathing problems like shortness of breath. But when COVID-19 pneumonia first strikes, patients don't feel short of breath even as their oxygen levels fall. And by the time they do, they have alarmingly low oxygen levels and signs of pneumonia as seen on the chest X-ray or CT scan. Normal oxygen saturation for most persons at sea level is between 96% to 100%. COVID-19 pneumonia patients' oxygen saturation may go as low as 50%. There are some surprising facts about COVID-19 pneumonia. These patients do not report any sensation of breathing problems, even though their chest X-ray showed diffuse pneumonia and their blood oxygen saturation was below normal. How could this happen? Some patients without respiratory complaints had COVID-19 pneumonia being investigated for some other medical conditions. The doctors are just beginning to recognize that COVID-19 pneumonia initially causes a form of oxygen deprivation like silent hypoxia. Silent because of this insidious and also hard to detect. Most of the patients with COVID-19 infection had been sick for a week or so with fever, cough, upset stomach, and maybe fatigue. But they come to hospital on developing shortness of breath. Their pneumonia had clearly been going on for days, but by the time they felt they had to go to the hospital, they were often already in a critical condition. Majority of COVID-19 pneumonia patients had remarkably low oxygen saturation in triage in emergency departments, seemingly incompatible with life. Although breathing fast, they had relatively minimal apparent distress. Despite very low oxygen levels and severe pneumonia on chest X-rays. Doctors are only just beginning to understand why this is so. The coronavirus attacks lung cells that make surfactant. This substance helps in air sacs in the lungs stay open between breaths and is critical to normal lung function. As inflammation from COVID-19 pneumonia starts, it causes the air sacs in the lungs to collapse and oxygen level falls. Yet the lungs initially remain less stiff with minimal fluid. This means patient can still expel carbon dioxide from the body, and without a buildup of carbon dioxide, patients do not feel short of breath. Patients respond for the low oxygen in their blood by breathing faster and deeper, causes even more inflammation and more air sacs to collapse. In effect, patients are injuring their own lungs by breathing harder and harder. 10 to 15% of COVID-19 pneumonia patients then go on to a second and deadlier phase of lung injury. More fluid builds up and the lungs become stiff. Carbon dioxide rises in the blood and patient develop acute respiratory failure. At this stage, some patients may need ventilatory support. Silent hypoxia progressing rapidly to respiratory failure explains cases of COVID-19 pneumonia, patients dying suddenly even before they reach hospital. There is a way we could identify more patients who have COVID-19 pneumonia sooner and treat them more effectively. And it would not require waiting for a confirmation with the coronavirus test. It requires detecting silent hypoxia early through a common medical device, a pulse oximeter. Pulse oximeter displays two numbers on its screen, oxygen saturation and pulse rate. Pulse oximeters are extremely reliable in detecting oxygenation problems and also variable heart rate. All patients who have tested positive for the coronavirus ideally should have a pulse oximetry monitoring for 2 weeks, the period during which COVID-19 pneumonia typically develops. All persons with cough, fatigue, and fever should also have pulse oximeter monitoring even if they have not had virus testing. Worth getting a medical attention if oxygen saturation falls below 90%. To date, COVID-19 pandemic infection has killed more than 195,000 people worldwide. Pulse oximeter may save lives by early detection of silent hypoxia. There will be deaths and bad outcomes that are not preventable. We don't fully understand why certain patients get so sick or why some go on to develop multi-organ failure. Many elderly people already weak with chronic illnesses and those with underlying lung disease do very poorly with COVID-19 pneumonia despite aggressive treatment. Is it time to get ahead of this COVID-19 virus instead of chasing it? We are all in this together and we all have a role to play. Meanwhile, stay home. If you are out, maintain social distancing and wear a face mask. Thank you for watching this video in these difficult times.